Let's be honest. When your head is pounding, your back is screaming in pain, or your temperature's spiking like a fire alarm, you probably go straight to your medicine cabinet and pull out one of two things: Advil or Tylenol. They are the go-to painkillers in almost every household. But here's the big question: which one should you take? And when? Well, in this video, I will be breaking it all down. I will walk you through the key differences between these two medications, when to take them, how they work, and what you need to watch out for. By the end, you will know exactly which one to grab next time you're not feeling your best, so you can get relief faster and stay safe while doing it. Welcome back to the channel, and if it's your first time here, don't forget to hit that like button and subscribe to the channel. So first things first, what even are Advil and Tylenol? Well, Tylenol is the brand name for a drug called acetaminophen, also known as paracetamol in some parts of the world. It's a pain reliever and a fever reducer. But here's the key: it does not reduce inflammation. That means it's great for headaches, fevers, the flu, or just general aches and pains. But if there's swelling or joint pain involved, Tylenol will not do much for that. Now Advil, on the other hand, works a little differently. It's the brand name for ibuprofen, which belongs to a group of medications called NSAIDs, that stands for non-steroidal anti-inflammatory drugs. And that anti-inflammatory part is key. Advil not only helps with pain and fever like Tylenol does, but it also reduces inflammation. So if you're dealing with something like a twisted ankle, dental pain, menstrual cramps, or arthritis, Advil is usually the better option. Okay, that sounds pretty straightforward, right? But let's take a closer look at what's actually happening inside your body when you take these medications. Acetaminophen mainly works in your brain. It helps change how your body senses pain and also plays a role in lowering your body temperature, so it is great for headaches or fevers. Ibuprofen, on the other hand, takes a more full-body approach. It blocks enzymes called COX-1 and COX-2. These enzymes are responsible for producing prostaglandins, which are the chemicals that trigger inflammation, pain, and fever. By cutting down on those prostaglandins, ibuprofen helps reduce swelling, ease pain, and bring down a fever. So here's the bottom line: acetaminophen changes how your brain feels pain, while ibuprofen works at the source of the inflammation. So which one should you take? Advil or Tylenol? Well, it really depends on what you are dealing with. Let's walk through a few common scenarios. If your pain involves swelling, inflammation, or anything musculoskeletal, like sore joints, a twisted ankle, dental pain, back pain, or menstrual cramps, Advil is usually the better choice because it helps reduce inflammation at the source. But if you are dealing with a fever, a tension headache, or just general discomfort, Tylenol might be the way to go, especially if you have a sensitive stomach or health conditions like stomach ulcers that make anti-inflammatory medications harder to tolerate. Here's a quick guide to help you decide. For headaches, start with Tylenol. For toothaches or sore muscles, reach for Advil. If you have got the flu with a fever, either can help, but Tylenol is often gentler. For arthritis flare-ups, Advil tends to work better. Post-surgery pain is a bit more nuanced. Doctors often recommend alternating between the two, depending on the procedure and your specific needs. And if you are pregnant, most healthcare providers recommend Tylenol over Advil, especially during the first 2 trimesters. Now let's talk side effects and safety profile, because this is where things get really important. Tylenol or acetaminophen is generally easier on your stomach. That's why it's often recommended for people with ulcers or anyone who can't tolerate NSAIDs like ibuprofen. But here's the catch. The big risk with Tylenol is liver damage. Taking too much, even by accident, can seriously hurt your liver. And if you drink alcohol regularly, that risk increases significantly. So never take more than 3,000 to 4,000 milligrams per day. Think of that as your safety zone. In fact, Tylenol overdose is actually the #1 cause of acute liver failure in the US. And here's something a lot of people do not realize. Acetaminophen is hidden in all kinds of medications: cold and flu meds, cough syrups, and even some prescription pain meds. So it's surprisingly easy to take more than you think. Always double-check labels or ask your pharmacist, especially if you are using multiple products. It's a simple habit that can help you avoid a dangerous overdose and keep your liver safe. On the flip side, Advil or ibuprofen can be harder on your stomach. It can cause ulcers or gastrointestinal bleeding, especially if taken for a long time or on an empty stomach. It can also affect kidney function, so if you have kidney problems or if you are dehydrated, Advil might not be the best choice. And for people with heart disease, long-term NSAID use can increase the risk of heart attack or stroke. That does not mean it's dangerous for everyone, but it's something to keep in mind and talk to your healthcare provider about. If you are older or have high blood pressure, this is especially important. NSAIDs like Advil or ibuprofen can raise blood pressure and increase the risk of heart and kidney complications. So in many cases, Tylenol is the safer option for seniors or people with hypertension. And if you do need to take Advil or any NSAIDs long-term, say for arthritis or chronic pain, talk to your doctor about protective options, like taking it with a proton pump inhibitor, PPI, such as omeprazole or pantoprazole. These medications protect your stomach lining from the acid and reduce the risk of ulcers. And here's another smart move. You may want to switch to a topical NSAID like Voltaren or diclofenac gel. They deliver the anti-inflammatory effect right to your joints or muscles with less impact on your stomach, kidneys, and heart. It's a great option, especially for older adults or anyone at higher risk of side effects. Now here's a question I get asked a lot. Can you take both? Well, the short answer is, yes, you can. But you need to be careful about how you do it. In some cases, especially when dealing with more severe pain or stubborn fevers, alternating acetaminophen or Tylenol and ibuprofen or Advil can actually be helpful. But timing is everything. You just need to space them out properly. Here's how it works. Tylenol can be taken every 4 to 6 hours and Advil every 6 to 8 hours. So for example, you may take Tylenol at noon, Advil at 3 p.m., Tylenol again at 6 p.m., and continue that pattern, spacing each dose about 3 hours apart. Another way to think of it: take one, wait 3 hours, take the other, and keep alternating. But, and this is important, do not just guess your way through it. Write it down, set reminders, and again, talk to your doctor or pharmacist before you try this method. And speaking of using them correctly, let's clear up a few common myths about pain relievers, because there's a lot of confusion out there, and it's important to get it right. Myth number 1. Tylenol and Advil are basically the same thing. Not true. While they both help with pain and fever, they actually work in very different ways and come with their own unique risks. So no, they are not interchangeable. Myth number 2. If you are really hurting, taking more will help faster. That's a big no. Taking more than the recommended dose will not speed up relief, but it can put you at serious risk for things like liver damage or stomach issues. More is definitely not better. And myth number 3. If it's sold over the counter, it must be totally safe to take whenever you want. That one's especially tricky because it sounds reasonable, but it's just not true. Medications like Tylenol and Advil are powerful tools, and they need to be used with care. Just because you don't need a prescription doesn't mean they're harmless. In addition, as I already mentioned, be careful with combo medications. A lot of over-the-counter cold, flu, and sleep aid products contain acetaminophen or ibuprofen. It's easy to accidentally take more than the recommended dose without realizing it, so always take a moment to read the labels. And try not to take either medication on an empty stomach, especially Advil or ibuprofen, which can be tough on your digestive system. So what's the final takeaway? Well, Tylenol and Advil are both excellent medications when used correctly. Tylenol is best for general pain and fever, especially if you have stomach issues, are older, or have high blood pressure. Advil is best for pain with inflammation, like muscle injuries, joint pain, or menstrual cramps. And there you have it. Remember, knowledge is power, and you have the power to make informed choices for your health. Thank you for watching.